Right, so Hashimoto's is a thyroid condition. It's an autoimmune thyroid condition. So instead of just the thyroid not working or stopping working, we've got it actually attacks itself. It doesn't work. Sometimes it's high, sometimes it's low, sometimes it works, sometimes it doesn't work, sometimes it kicks in. So rather than just being able to be treated with medicine and it level out and do, it can be working for a while and all of a sudden just jump off the charts or drop really low, and it still causes all the same symptoms: hair loss, extreme exhaustion, mood disorders of fluctuating moods. And my mother was misdiagnosed with her thyroid condition for years and years and years as just being a depression. She just had postpartum depression with her children. The problem with Hashimoto's and thyroid conditions, period, is when you're pregnant, it may not be showing up. You may not even have it until all of a sudden you've had a couple babies and it triggers it for some reason. So when I was younger, I had all the symptoms. And when I was in high school, I'd be extremely exhausted. I would have all of the problems with hair loss and mood swings, etc. But they would always test me and it would never be a problem. It was just barely borderline within this range of what they call normal, but it was high end or it would be low end. But they wouldn't treat it because it wasn't there, not realizing it was an actual underlying autoimmune problem making the fluctuations happen. After I had my fourth child, all of a sudden I started having issues and problems with digestion and other mood disorders and stress. By the time I had my sixth child, I was losing weight like crazy, couldn't figure out why. I was eating like nothing else, and then finally went in because my blood sugars were not maintaining themselves, couldn't keep anything. I'd gone from 125 pounds with a baby to under 100 in a matter of a few weeks. And so they finally tested me for the thyroid condition itself, found out I was way off the charts, started treating it. My mother said, don't tell them you're depressed. Don't tell them you're doing any mood disorders, because most doctors, the first thing they think of instead of thyroid or anything else is depression, postpartum. They don't ever go to what it could possibly be. So my mother, having gone through the same problems for her diagnosis, at least helped me, because she could tell me the right questions to ask, tell me to test the right things. It wasn't until about 10 years later that actually the Hashimoto's was diagnosed, when they couldn't figure out why I was up and down and up and down, and the medicines weren't working to keep me level. They did a blood test and could see the antibodies that were going on and figured out, yeah, Hashimoto's, it's never going to level out. We're just treating you. Some days you're going to feel good, some days you're going to feel bad. And we just try to keep on a single dose. Recently, the last year, they've had me on medications that they just keep upping and upping and upping, and nothing is bringing it down. But the medications cause the same side effects, so it's hard to tell where you're going. Medications cause exhaustion, the hair loss. You just are like, do I feel better? Do I not feel better? The biggest problem with it is if you don't keep it under control, it can cause heart problems and other things later, because your heart starts racing. It doesn't keep other things under control. So it's a struggle trying to figure out where the balance is. Do I take the medicines? Do I not take the medicines? Do I feel better without them? Do I feel better not with them? You're like, sometimes it's a game with the doctors of, I'm going to take my medicine for a while, but if I stop, it's because I don't feel good and I feel better not taking it, and then they get mad at you. And you just do what's best for you sometimes and play the games that doctors don't get it all the time, but it's what you do.